and we'll get this train going really quick. Hold on one second. Let me turn this off.
So just so everybody knows, the reason there's two of me is because I have one audio and one video, because my whatever this thing is, Chromebook or whatever, can't seem to handle video and audio at the same time. Like, it's too much for it. So I do audio on my phone and video on my Chromebook.
Oh, you're fine. You're fine. So I appreciate it. Oh, and here's Lisa. Many of y'all know Lisa. Oh, that's my sister in Philly. So Lisa, look, Christina's here. So, so and you're on and I'm gonna go ahead and show the video. And that way we can go ahead and get going. And my cousin Denise showed up. So let's get rolling. Screen share. Share sound. Here we go. Don't forget to press record.
Every day.
Every day.
Every day.
We wake up with one mission: care no matter what.
We are providers,
Nurses, educators,
researchers,
Activists, advocates. Every day, at 600 health centers operated by over 50 Planned Parenthood affiliates across all 50 states, our patients are our priority.
2.4 million patients come to us for care each year.
People of all races,
Ethnicities,
and immigration status,
from different religions,
political affiliations,
and income levels.
Every sexual orientation and gender identity.
we are here for you.
To provide compassionate and expert care.
no matter what.
No matter what. Birth control,
STI testing and treatment,
Cancer screenings.
Sex education.
Safe, legal abortion.
And more.
And more.
And more.
Every day, we fiercely protect every person's right to access that care.
No matter what.
Planned Parenthood is all of us.
is all of us.
It's all of us. All of us.
13 million supporters committed to building a world where every person can access the care they need
to live the life they want. We are strong. We are resilient.
Somos fuerte.
Somos poderosos. It's who we are.
It's what we do.
We are.
Somos.
We are.
We are.
We are Planned Parenthood.
Planned Parenthood provides care for patients across the country, no matter their zip code, their income, their race, their immigration status, their sexual orientation, or gender identity, no matter what. In Washington, some politicians are trying to defund Planned Parenthood. But what does that really mean? Millions of people come to Planned Parenthood for healthcare services like birth control, STD tests, cancer screenings, and sex education. And Planned Parenthood proudly provides safe and legal abortion, a medical procedure federal health programs won't pay for except in extremely rare circumstances. The care that patients get at Planned Parenthood prevents an estimated 579,000 unintended pregnancies each year and saves lives through early detection of cancer and other life-threatening conditions. 60% of the people Planned Parenthood serves rely on federal programs like Medicaid to help pay for their preventive and essential health care. And just like every other hospital or doctor's office that takes Medicaid or any other insurance, Planned Parenthood is reimbursed for the specific care we give each patient when they come to us. So when politicians talk about defunding Planned Parenthood, they're not talking about striking a line in the federal budget. They're talking about blocking millions of women, men, and young people from getting essential and life-saving care. Here's what their plan would cost Americans. An estimated 1 in 5 women in America have been to a Planned Parenthood in their lifetime. Nearly half of all Planned Parenthood patients are people of color. For many people, Planned Parenthood is the only place they can get care in their community. In fact, more than half of Planned Parenthood health centers are in rural or underserved communities. Defunding Planned Parenthood would be disastrous for our nation's health, and the people who would be hurt most would be those already struggling to get by. Planned Parenthood doctors and clinicians open their doors every day because we believe that every person should have access to the care and information they need to make important decisions about their health and their future. These are basic human rights, and we're doing everything we can to protect them. Visit istandwithpp.org to find out how you can help.
Good evening. My name is Fawn Rhodes, and I am doing my final project on should Planned Parenthood receive federal funding. So one of the first questions I would like to ask you is when you hear the name Planned Parenthood, what is the first thing that comes to your mind?
I would say it's a tie between abortion and birth control.
Abortion, okay, and birth control.
Birth control.
Birth control, okay. Anybody else?
I would say it's a tie between abortion and birth control.
Okay. So that was my first thought too. Anytime that I've thought about Planned Parenthood, I've always thought that it was because the narrative politically, what we hear in the newspaper, we always hear about abortions connected to Planned Parenthood. I wouldn't even say birth control. I would say abortion is the number one thing that most people think of when they think of Planned Parenthood. However, Planned Parenthood actually provides more services than just abortion. And it also doesn't just provide services to women, which I was ignorant to. It provides services also to men and young men. So that was something that I was not aware of also. So in that understanding, as far as the services that Planned Parenthood is currently, Planned Parenthood was receiving approximately $500 million a year from the federal government to fund their agency or to fund the healthcare services. However, recently, and that was under the Title 10 agreement or Title 10 policy that was there. But under the Trump administration, one of the things that the stipulations within Title 10 was that they also, in order for them to continue to receive funding, that they were going to have to reveal the doctors that were providing healthcare services and also the patients' names that were receiving health services. And I personally didn't understand how that could be a stipulation within the policy when that's a direct conflict with HIPAA. So basically Planned Parenthood pulled out of that and stopped receiving and chose to no longer be to receive Title 10 funding, which would mean that that's approximately $50 to $60 million a year that they would not receive. And $50 to $60 million in some cities, some states, that could be a whole clinic that could be shut down. And for some cities, some towns, some areas, where you are, that may be the only healthcare facility that's in your area that provides healthcare for you. So the discussion or the table that's on, or the topic that's on the table is, should Planned Parenthood receive federal funding? My initial knee-jerk reaction was no. And my perspective of why I felt that they should not receive federal funding was not because I was against any of the services that they provided, because I myself have been a beneficiary of Planned Parenthood. But I felt that if they wanted to keep the government out their pocket and telling them what they should do and should not do, the easiest way to do that is to not take their money. And my thought process was, if they would only set up a construct such as like United Way. United Way is the #1 nonprofit fundraising organization in the world. And none of their funds come from the federal government at all. All of their funding is directly raised from independent, private, and public entities. I know Nita has actually headed the United Way campaign for her the company that she works for for many years, and I mean has raised a lot of money. So my thought process is, with so many people who are strong advocates of Planned Parenthood, why could they not pull on those purse strings to receive the funding that they need? That way they would not have to have the federal government tell them what they can and cannot do. However, that's not what the things are right now. So that could be a future vision for them, but as it stands, that is not how they're set up. So if that money is pulled, that means that people like me are going to be affected. I am a low income mother. I make less than $30,000 a year. And I receive Medicaid, and my son receives Medicaid. And so what that means is that women such as myself, or children such as myself, would be the ones who are directly affected by it if I did not have another facility to go to. So those are just some facts I just want to put out there. You all can jump in, and we can get this ball going. And like I said, wherever on the pendulum that you fall, it's okay.
I'm fine. You can hear me clearly, right?
Mm-hmm.
Okay, just want to make sure. That was a good introduction. I like that balance, so we could see a clear vision. Even though I had my own, I'm familiar with Planned Parenthood myself. So it was good to just bring across the border the presentation, both of them. So it really helped out a lot. And then the background, it really did help. And then, I mean, you get some good points regarding, why can't they just, I didn't know they were 100% funded. I didn't know that by the government. I never knew that. So I learned something new today. And then also you put a different perspective regarding United Way. They do fundraising, why they can't do it that way too. So those are good points on both ends. And that's a question to talk about, but I believe it still is needed. But it's a shame with media, they put the stereotype of, abortion. That's the only thing we focus negative. But there is positive things regarding it, but it's a shame there's stereotype. Planned Parenthood, the first thing you hear, you think of as abortion. It's a shame, but that's how it is. So just want to put that perspective in there.
Yeah, I think that in my perspective, they push the abortion narrative, that the media push the abortion narrative so it can trigger the conservative and the Christian right. And many of those, all of you all, I know, have your own personal relationship. And all of you all that I know, are stronger in your faith. Yet at the same token, for those I know that I am, Lord, Lucy had to correct me the other day. Which one is it? I can never remember which it is, but pro-choice. There you go. That's me. I'm pro-choice. I just don't want no man in my womb telling me what I need to be doing with my body. He don't carry a child. He doesn't know what I go through. I'm not in his body. So the same way I feel about my rights, I feel about his rights. He should be able to do whatever he wants to with his body. If he wants to go get himself cut and not have any more children, that's your personal choice. It's your body. You do what you want with it. But I really feel very strongly about the government making a fine line to determine what we as women should be doing with our bodies. And so what they tend to do is, especially the federal government tends to take what I like to call the Pontius Pilate type of perspective. Whereas when Jesus was being crucified, they took him to Pontius Pilate, and Pontius Pilate was like, he said to the Sadducees, like, well, what do you want me to do with him? Right. And made them make the decision about what it was. He didn't want to make a decision. And so basically what they tend to do is they try to push back and make it a state decision, each state determines what you want to do. So their hands are not dirty. So the federal government, so to speak, is not dirty. However, what the problem with that is that there's no unity or equity in those decisions. So what North Carolina may be doing right next door over here, South Carolina, is some fools doing something different. Whereas South Carolina, there may be somebody over in Virginia doing something different, and down there in Texas, they just had some stuff that happened. So there's no equity in the decisions that is made. Whereas when it's done federally, those decisions, whatever they say, has to be done across the board. And so it's a challenge, like I said, because that's how they tend to do it. And so now we've got everybody making decisions for us, but not us.
I agree. With Planned Parenthood, when I was in high school, I only associated them with birth control and condoms, even though I never went, but that's what all the high school kids went to Planned Parenthood for. I didn't hear about the abortion side of it until, I'm sure I was like 18 or 19, but at the same time, that's not, that was never my first impression. And it may be because of the environment I grew up in, where my family is mostly Democrat or liberal, and they're not conservative. So they're not pushing the, don't participate in this agenda or whatnot. To my knowledge, they are pro-choice, and that's how I was raised. I do think that people get anti-abortion and pro-life confused, because those are not synonymous. And when they try to appeal to the conservative or Christian right wing or whatnot, they say, they try to say, we're pro-life, this, that, and the other, but you're not really pro-life, because Planned Parenthood does so many more things to help people's lives than just, abortions don't necessarily, yes, there may be a mental or some guilt associated with having an abortion. I've never had one, so I don't know. I'm just speaking based on what I hear people say. There may be some guilt associated with it. However, how much worse is that person's life if they have an unplanned pregnancy and they can't take care of their child? They end up homeless. They end up getting their child taken because they can't provide. Because these are realities that, de facto child, I'm not sure what they're called in other states, but if you can't provide for your child, you can't keep your child. If you can't provide a safe place for your child to sleep, you can't keep your child. If they come and do a home evaluation and your child is over 6, and your child doesn't have their own room and they're sharing the room with you, they frown on that, because children that are of a certain age should not be sharing the room with their parents. So, I believe they should have federal funding just to help people who are low income make wise parenting choices. However, if you're going to take that away, then you need to provide the funding somewhere else to help them take care of their children once they are born. Even if that requires you to take care of them until they're 18, you need to provide an alternative, because if you block birth control, then you have children in foster homes, you have children in homes where the stress level is already high enough and another child does not need to be added to the household living situation. I mean, it's just that you have to have an alternative when you talk about taking away somebody's ability to choose the birth control, for lack of a better word, that they desire to have.
And that's a very good point, Donna. One of the also stipulations with Title 10 was Title 10 put in a stipulation where the providers of Planned Parenthood could not discuss alternatives with the patient. So in addition to providing, asking them to provide who their service providers were, the clients, they also wanted to put stipulations on you could not discuss alternatives or options with that person who came to receive, I guess you could say, birth care. I don't know the actual phrasing that is used, but if you're in the office and you are pregnant and you're trying to make a decision on what you should do, they cannot, Title 10, one of the stipulations was they could not discuss that with you and present you options. What they could do was put pamphlets out, and if you perhaps saw the pamphlet,
if your reading level is high enough,
There you go. Right. But if you're 4'1" and the table is like 5'2", I doubt you see it. So it's one of those situations. And it was basically tying their hands. And so that's one of the reasons why Planned um they voluntarily elected to not receive Title 10 funding.
So can I ask a question? And I'm sure the title is something different when it comes to Medicare or Medicaid, and Medicaid being the healthcare provider or insurance provider rather, for low income family, women, children, and men. So when you want a service through Medicare or Medicaid, I'm sorry, paying for it, the HIPAA violation is not there. Yes, you have to justify why a person needs braces. Yes, you have to justify why a person needs glasses under Medicaid. But other justifying, birth control and who the providers are and who the patients are is not, it doesn't go beyond Medicaid. It doesn't go to somebody else's hand outside of the insurance provider. And what Medicaid is justifying is, to an extent, the same thing your private health insurance would require your doctors to justify too. Whether or not a certain prescription needs to be generic or name brand. Those things, I get that. But are they wanting to strip Medicaid of there or require Medicaid to have the same requirements? So that's fully government funded.
That's a great question.
Except it's state administered, but it's federally funded.
Right.
So I'm just wondering if they're.
Yeah, those are, I don't know the answer to that, but that's a great question to dig deeper into. If they ask those same questions, was Medicaid having to provide that same type of or fall under those same requirements?
Fawn, it's really a shame that our country practices such hypocrisy. I'm not a big athletic fan, but I've been watching the news and how college ball has such a differentiation between what the women's basketball teams get and what the men's basketball teams get. And if it wasn't for them making so much noise about the level of inequities between women's and men's basketball, then they would still be suffering. I mean, it's still not equal, but what the women have is so much lesser than what the men have. And I think across the board, America just does not respect women as they do men. And we would like to believe that in 2021, all things would be equal. But if we were talking about rights for men, this conversation would be totally different. And it's really kind of shocking that the government feels that it has the right to impinge upon women's private decisions that they make. And so I think that, there's so many different parts of the law that we have to review. The Voting Rights Act, who would think that in 2021 we would still be revisiting that? I think that this is another issue that we need to be revisiting and let the government know that really they're out of order. This is another thing that they're really totally and completely out of order about, because there's no reason why Planned Parenthood should not be able to get funding for something as important as women's health. I was really very upset to know that just about every state in the nation will fully fund sex change operations for people. I couldn't believe that. So if someone decides that they, want to become transgender, I always thought that was a private operation, but to know that the government will fund sex change operations really blew my mind. So, if they can fund sex change operations, why can't they fund women's health? It's ridiculous.
That's a great perspective. And you're right. It's the inequity that is across the board in terms of just being a woman It is. We could be here all day, all night for the remainder of the year to discuss all the levels of inequity. And then let's not even begin to chip at the the glass ceiling when it comes to being a black woman and the inequities that are there. And I tend to identify and say black woman and not a woman of color because as we know that there are other ethnicities that fall within it that do receive better treatment than we as black women. Um, so I definitely agree with you. I think about I think about my personal experience when I was in the hospital having my son and just the level of um, poor care that I received when I was in the hospital. It was just absolutely terrible. Not only was the care terrible, the treatment was bad. I had made a choice that I did not want to breastfeed, and I had I don't know if she was a charge nurse or if she was the nurse on duty or whomever, but I think lactation nurse. That's what it was, a lactation nurse, who came in my room and was extremely forceful with trying to make me make a choice to breastfeed my child. And I had already put in my birth care that I had made a choice not to breastfeed. And so she just kept coming in. And I was there for 3 days and came in every single day asking me had I changed my mind to to breastfeed. Like she was literally putting the pressure on. And then the last day she sat down with me, and I, in full disclosure, I will say she was a white older female, and she said to me, well, if you were on an a abandoned island and didn't have a way to feed your child, what would you do? And I was like, but I'm not on an abandoned island. So how does that question have anything to do with the choice that I've made in terms of not, breastfeeding my child? But and she was so forceful, so much so I didn't get all the information that I needed, aftercare information that I needed. So I went home and didn't know that my milk was going to come into my breast. And I had no idea how to handle that. I literally thought I was getting cancer because my breast had like swole, and I was just, just going through, it was aching, everything that you could possibly think of. And so I had to call back to the hospital, and they said, well, did they not give you aftercare and tell you what to do? I said, no, I didn't get any aftercare. All I got was told that I should be breastfeeding. And so they went on to tell me different steps to take, like to, tightly wrap my breast and stuff like that. And after a couple of days, it'll, the milk will start depleting on its own after going to the bathroom. But the point I'm making is that there was no respect there. There was just no respect there for my decisions. And I just feel like when it comes to healthcare for Black women, we don't have a voice. And I see that across the board in so many ways. But that's just kind of getting off to the side, and that's off topic from Planned Parenthood, or maybe it could be connected to Planned Parenthood. But and I guess the way I do see that is connected to Planned Parenthood is without Planned Parenthood, we can be placed in some women can be placed in situations where they are faced with going to some of your traditional healthcare facilities and their voice is not being heard. So that, I guess that's where I was kind of going with that, was just, we need to be able to be in a space where your voice is heard. And I just find that more often than not, that our voices are not heard.
I also think too that Planned Parenthood may be more youth friendly than a lot of the other traditional um, um, medical facilities, because I work with young people, and over the years, many of the young women in particular chose to go to Planned Parenthood to, to discuss sex education, health education, things that probably were not reviewed in school, and topics that they didn't feel comfortable discussing with their families. And so that's just another option that many of the young people had in terms of being educated about about the young women and their bodies, and options for different things that Planned Parenthood will provide for them in terms of services and information.
And that's very true. Not only does it provide that for youth, I also find that Planned Parenthood does provide that for those that are in, it's a safe haven for those that are in the LGBTQ IA. I may be leaving off a letter, but in that community, because oftentimes many from my association and conversations with some who are in that community, that they don't feel comfortable going to certain doctors because they're not respected in certain, unless you have money sometimes, like I think, and that I find that in a lot of cases. But going to certain facilities and being in the LGBTQIA area, I think a lot of times their voices aren't heard also. So being in a space like Planned Parenthood, where it's a safe space where they can go and have that discussion and get safe health care, or condoms or birth control or whatever the case that they may need, STI testing, STD testing, and not have to feel that and feel any type of judgment that's attached to it. Those are some of the reasons why I think that Planned Parenthood is beneficial for the community at large.
I think based on the services that they provide, I think it's more important, no matter where you stand politically or even morally, on the types of services that they provide. I think it's important that they do provide those services, because at the end of the day, you're talking health, you're talking disease screenings, you're talking cancer screenings, you're talking about education and some very, vital and critical services for people, especially people of color and people, in rural areas. Because for many of them, that's kind of like their only choice, because they may not be able to afford to leave town and go to, the next city over or next couple of city over to get those types of services. So for that reason, well, that's the primary reason I think is that health should come first. And that's my primary reason why I do support government subsidies being funded to Planned Parenthood. And the second reason why is because when people think about government funding, and they think about subsidies, there's a stigma attached to that. When you hear the word subsidies, you think of a Black or a brown face with their hand out, right? But and politicians use that catchphrase as a talking point to sell, to sell whatever they're pushing. Okay. And then they also use that moral question. Like, some people vote completely on one moral issue, and they don't look at a person's political record. They don't care if they go home and wear a white pin on their head. They don't care if they're Klan. They don't care. They will vote on one political issue, whether that's abortion or whatever that is. They will vote on a moral issue and ignore some people will not even educate themselves on where this political person stands, and they will ignore all the other issues. And I think that's smoke and mirrors, because at the end of the day, the number one, I feel like people of color, and I don't believe that people should be lazy and should just sit home and have a bunch of babies. But I do believe that people, especially if you ever worked, you have paid into the system. I think as a citizen, they borrow against your social security number as a citizen. I think that you are entitled to certain benefits as being a citizen of the United States. And the most subsidies of all go to big business. They would rather pay Jeff Bezos, you know, $500 million to bring Amazon to keep Amazon in New York State. They would rather pay Boeing billions of dollars, General Motors billions of dollars. These companies receive billions of dollars in government subsidies. If you go out and look at who is the greatest recipient of government subsidies, it's big business. And a lot who got the PPP, big business. Even businesses that didn't have layoffs, that weren't even affected in the same way by COVID-19 got those government dollars. So I feel like, yes, programs like this should get government dollars. I think it does give the government some preview into how they kind of operate, but I don't think the government should be able to tell a person, you know, should be able to control the information that's disseminated by the organizations. I think that that's wrong. But I took a quick look at their annual report, just glanced at it, and I think they receive over 34% from government funds. And then there's a certain percent from non-government health services revenue, and then private contributions and requests, and then support from affiliates. So they don't receive all of their funds from the government, but I feel like the services that they provide are critical, and they should get the subsidies because so much is earmarked for businesses, which we need jobs. This is true, but I work for a company that received subsidies, you know, years ago, that benefited from when Trump did some taxes. He put something into law for taxes. Our company benefited, and we got a bonus. Great. But you have a lot of but he said it was so that companies wouldn't send jobs overseas. But the companies still, I didn't say my company in particular, but I know they still sent jobs overseas. So it just lines the pocket of big business. And I feel like our citizens are entitled to, should get some assistance if needed.
I agree with you with that, because one of the things that you and I were discussing in terms of your taxes, you know, when you pay your taxes and your taxes are pulled, I have a problem with them saying, well, we can use your taxes to pay this, but we can't use your pet taxes to pay that, you know. And so they want to pick and choose where our monies go and who our monies assist. And yet I'm the one that's a direct beneficiary of the things that you're cutting, and I'm paying taxes, you know, into these things, and you're cutting the services that I need. So it's and you're right, when people, especially, I loved how you broke down subsidy, because subsidy is, we so often when we're hearing the term subsidy, the immediate connection that you think of is brown and black people who are in social services trying to receive EBT or
Food
trying to
stamps and
receive,
welfare. That's what we think.
you know, living in the projects, or welfare, or you know, or whatever the case may be. You know, what is the one where they help you out with your house? That, you know, those type of
Section 8, you know.
Yeah, Section 8, exactly. And so they immediately want to draw the line between subsidy and Section 8 and welfare, but subsidy actually is big business. It's
If they cut those
we
programs, they're going to be
the-
earmarked for what they want to spend their money on, whether that's, I don't know, wherever they want to send those dollars to. If they cut those programs, it's going to go to it's going to take more services that they're being rendered to the poorest and most vulnerable citizens. The poorest and most vulnerable citizens, if they have any type of job, the poor and middle class, especially the middle class, but also the poor, we bear the largest burden of the tax dollars. So we're paying the most money into the system, but yet and still they want to take, you know, services rendered to poor people that basically just kind of help them have a slightly better quality of life by having access to medical, medical care away from the people who need it the most, the people who are most vulnerable, and line the pockets of the people who need it the least, which to me is such a disparity. And that we need to educate ourselves more so that we can advocate for programs that matter, or programs that if we haven't benefited from, we may be the first generation who haven't, but people in our family or a generation ago did benefit from these programs.
And to add, I agree with what Nita is saying, but even to add to that, white people receive more welfare program subsidies than Black people do. And, and they don't, I think there's a racial element to this because, and I hate to bring up that, all Black women forum, but I mean, it is what it is. It is what it is. The Planned Parenthood, if their base, if the people they help the most are people of color. And they're trying to do things to make sure that people of color don't receive this. That's why I asked the question about Medicaid, because there's so many more white women receiving Medicaid than it is Black women.
Yes, it
There's
is.
so many more, whatever, and they're not required. I don't believe that, because we would have heard if they were requiring the same thing for Medicaid. So I think there's an underlying racial element to this. Like I said, I don't know the answer for definite, but that would have come up. We've heard about them trying to cut Planned Parenthood funding for years. They've been doing it over and over. They try to find ways about, to do that for years. And I'm not saying it's completely a race thing, because I do know that white people are slowly or quickly, however you want to look at it, becoming the minority in the United States. And white women can access Planned Parenthood, abortion, and birth control elements as well. And I believe that's why a lot of people, regardless of your religious belief system, don't support abortion or anti-abortion, not pro-life, but anti-abortion, because they think these white girls are having all these abortions and cutting down the birth rate, or they're using birth control and cutting down the birth rate so that we're going to become a minority. Well, if there's nothing going on, we're so scared about being a minority. I mean, if everybody's treated right, if everybody's treated fairly, and there's not a racial undertone about that, there should be no issue with being.
Donna froze. But to Donna's point and what she was saying, that's something that that I have observed myself. It's funny how I find that the microeconomics is always pushed ahead of macroeconomics. And what I mean by that is that they take the smaller people who are benefiting, such as people of color, and portray that we are the main ones overutilizing, and abusing the system. When the macro economics is people who are, like I said, we're not shifting races, we're just stating facts, that white people are more benefiting from certain services than we are, because it's more of them than it is of us. So I mean, I can just speak for the fact here in where I am. I'm in Wilmington, North Carolina. In Wilmington, North Carolina, Black people, sadly, we have gone down in terms of our population demographic here. And Franchon, you might be able to you may or may not know if I'm speaking truth or not, but I think we have gotten down to close to 3%, somewhere about the 3% population as far as Black people here in Wilmington. Our numbers have drastically dropped here in Wilmington, and throughout the years. And it's amazing. But when you look at the television, and you would think that Wilmington is, everything that's happening, from the violence and everything that's happening here in the city, that it's them Black people, but it is not. And so with that being said, I find that to be the case, is that they like to push the narrative that it is us who are benefiting more towards Planned Parenthood issues and it's not. And more Black people, from my experience, are more conservative in their choices than many people actually believe. More Black people actually choose to have their children than abort their children. More Black people choose to keep their children at home before sending them to foster care or putting them up to adoption. And at least, like I said, in my experience and in my knowledge, I don't have the actual hard numbers on that, but just from my being Black all my life, and and looking in the community and how things are set up, I know of many Black families that foster. I can't tell you how many Black families that I know that offer foster care. Just to keep families together. They will, like, 4 and 5 kids will come. My grandmother, she wasn't a foster care, but my grandmother kept all her grandkids when my mom had passed, and a couple of my aunties and uncles were in a good place in their life. My grandmother basically almost at one time or another had all her grandkids living in the same house, just to keep the family together, opposed to sending them out to different foster care. So I agree a lot with what you're saying with that, Donna.
And it's just code words being used because I don't know if you all remember when Mitt Romney went to, I want to say Utah so bad, but it might have been Idaho or somewhere like that, and he spoke to that crowd in town hall meeting, and he was talking about canceling Medicare, food stamps, and all this, and because they were farmers and they had a bad crop time, they weren't making money, and 98% of the people there were on food stamps. And so when you use the code word Planned Parenthood and abortion only, people don't think it's going to affect me, just like they use Obamacare instead of affordable health care. You will hear people say, oh, I want to cancel Obamacare. I got insurance through the Affordable Health Care Act. Well, what did you think Obamacare was? The only reason it's called Obamacare is because Obama, for lack of a better word, took Mitt Romney's plan that he made when he was governor in the state that he was governor of and applied it to the entire United States. And because they were on opposing sides of an election, Mitt Romney couldn't say, hey, you stole my idea. He had to let the plan roll under Obama's name, and they nicknamed it Obamacare. But the affordable health care is exactly what Mitt Romney signed into law as a governor before he ran for president. And so the code words, I think, like Nita was saying, will get people to vote against certain programs and vote against certain things because, oh, I see black, I see brown, I see yellow or I see olive tones when I hear this word, and not realizing you're cutting your own nose off to spite your face. No, it may not be your literal nose, but you are damaging your own community, all in the name of impoverished Black people, or people of color, rather.
Mm-hmm. I remember that. I remember when he put his foot in his mouth and not understanding, because again, being detached from poverty because you're several generations rich, being detached, you think in your mind, you think that you associate a black or brown face with government subsidies, not even understanding that. I mean, mathematically, if we only make up 13% of the population, but white people make up 60% of the population, though it may hit us harder proportionally to our 13%, the numbers game say there's going to be more of you as a majority in this country that are going to be impacted and receiving those benefits. And when they think like affirmative action, more white women have benefited from affirmative action than any other group in this country. But again, they have those talking points that they speak to kind of radicalize, kind of separate people according. Basically, it's an undercurrent of racism that they're speaking to within their own community, and it really is hurting poor people because poverty there's no color on poverty. Poverty is poverty, and even though our numbers may be you know, it always affects us. You know, there's many things, including poverty, that affects us, Black and brown people disproportionately. It still impacts other communities as well. And, you know, they play the game.
Completely agree.
Well, I don't want to keep you all too much longer. Did you all have any? Did Lisa, Lucy, or anybody else have anything that you want to add to the discussion? Like I said, my goal was not to keep you all here for a very long time. I just want to um, have a discussion about it, get in and complete my project.
I did want to add just one little thing. It's not that I don't agree that there are racist undertones to the Planned Parenthood situation, but I think primarily it's a woman and a moral issue. Because even if you took the government out of the question, it would still be a problem. They still would come after Planned Parenthood because of the fact that these children, they feel that these children are being murdered, the fetuses, you know, when does life start, that whole thing. So while I do believe everything that you guys have said it is relevant, it does apply, but it still has to do a lot with women and what the moral attitude of the United States and this whole thing that these babies are being killed. They're worried about white babies being killed more than they are about Black babies being killed. It's the whole thought that when does life begin? And if there's murder and there's killing, then we bring the whole Christianity umbrella into it, and and thou shalt not kill. And that has a lot to do with their moral stance as to why there should not be abortion. And even though Planned Parenthood has graduated and grown to include all of these other sexual health issues, they didn't really start out that way. Right. They have grown to include, including the LGBTQ community. All of that is a growth process that has happened over the years. So a lot of people think of Planned Parenthood as you guys said before, as abortion or what do you call it, birth control, because that's where they started. And so they think that, you know, it's a killing field for babies.
And to your point, the way it was started was so the founder of Planned Parenthood, her name was Margaret Sanger. Let me make sure. Margaret Sanger. Margaret Sanger, if you take your time and do some research on her, she was a known racist and a known believer in eugenics. That's what Nita and I were talking about when some of y'all first came on. And so what is eugenics? Eugenics is believing that one race is higher than the other. And so it is a way of extinction. So killing off others who do not look like us or fit what we want. So where do we see eugenics, or what's most known, or someone who's most known for in terms of eugenics? Hitler. That is that is one of the biggest things that comes to people's mind when they start thinking about eugenics. They think about Hitler. But we can fast forward and we see that within the Tuskegee experiment. We see that in other in the killing fields of the Native Americans. We see that in the Japanese concentration camps. So it's United States has a strong history of eugenics, and indirectly indirectly sliding down that road to get there. You understand what I'm saying? And exactly, sterilizations. And so we try to skate past that, but it's there, right? And so, like, I know, I actually have found a video. It's too long to watch, and I can send it to you all if you want it. But and in New York, they actually, the Planned Parenthood in New York had went ahead and removed Margaret Sanger's name from the Planned Parenthood New York Center there, because of her history of being a known racist. When she created Planned Parenthood, she solely created Planned Parenthood as a method to help white women, to give them alternatives, to help them during the women's suffrage movement, because of what was going on in terms of poverty, and around that, also around the time of women's suffrage. Fast forward from women's suffrage, we went straight out of the women's suffrage and went right into Wall Street. When Wall Street fell, what was it?
Great Depression.
I didn't hear you.
Great Depression.
Right, exactly. So we transitioned right out of women's suffrage right into the Great Depression. And so with all of those connections, it was a way to help provide health care for white women, and a way to help them control the amount of children that they were having, because it was so much poverty that they were being affected by. It was never supposed to what Lisa was saying, graduate to be all inclusive, but it has. Like, life happens, evolution happens, things evolve, and here we stand. And so to your point, that is why people do associate abortion and birth control with Planned Parenthood, because that's the foundation of how it was created. And
but also we cannot forget that women were having abortions, and it was unsafe.
Yes.
And they were dying.
Yes.
So we can't leave that part out of it too. Like Planned Parenthood, whoever it was designed for, it was also to save lives. So it gave women an alternative, and they were making the choices anywhere, but they were going places where it was unsafe, and they ended up in an alley somewhere bleeding to death. I thought that was very dramatic to make my point, but but Planned Parenthood does have its place, regardless of who it was for initially and where it has evolved to now. They do, as far as sexual health and women's health and men's health, it does have a place, and it provides safety as people make decisions, these hard decisions, when they come up against them.
Yeah, that's, I'm glad that you brought that to the table, and that is correct. And it does ultimately does boil down to moral, where you stand morally, in terms of your decision making. And to what Nita was saying, when people vote, people don't vote with finances in mind. People don't vote and say, okay, well, $20 million is going to be allocated to this particular fund or this community. They vote with their heart. They vote with, how is it going to affect me? How does this move the needle? And that's when you're seeing television ads and they are pandering for your vote. Yes, they throw some numbers out there, exactly, selective morals. Yes, they throw some numbers out there, but ultimately it's all about, you see the grandfather holding the granddaughter. Mike, Jones was, known to be, he has 15 grandkids and 20 dogs. Let's not forget the dogs. They're going to put all of that within the commercial to to generate your heart so you can vote in that particular direction that they want you to go to. And if it has anything to do with specifically in terms of white supremacy, if it has anything to do with family, that's what they support. They support family. It's about, the larger the family, the greater the family, the better, the more fruitful your family is. At least from my understanding and from my history and my understanding, they strongly believe in large families, because large families do what? Pass your legacy, and it creates generational wealth as time and things evolve. So and whereas as time has happened, Black families are getting smaller and not larger. And I see white families still continue to expand the same way that they were years ago. And yet we're still losing. So those are just some observations that I picked up. But
I'm sorry, my daughter was talking and I was trying to tell I wasn't muted. But yeah, and I agree with that, because if it was a solely moral issue, then they would have a moral issue. That's why I said people are anti-abortion and not pro-life. They would have a moral issue with children in cages being separated from their families. They would have, it doesn't matter that it started under President Obama or even that it was even more drastic under President Trump, but it's still a moral issue. They would have an issue with trying to send DACA immigration recipients back to countries when they were born here, or they came over here.
Yeah.
If it was a moral issue, then people having anchor babies, like President Trump's wives have all had except for one, have all had anchor babies. They send everybody else back. They say your baby can come back over there when they're grown, but you're not a resident or a citizen of the United States. So you have to go back home and you have to take your child with you, as opposed to people who have become citizens or were actually born here and had children. So that's why I said it was selectively moral. It's solely, and I shouldn't say solely, that's not right, but it is primarily an issue with preserving the white family, and they cannot preserve the white family.
Yeah, of preserving the white family, but it's something about the babies, and you do have a very good point. The conservatives don't have any kind of care for after a year. They don't give a flying flip about you. It's before you get here, and really once you get here, you on your own. And I'm talking about the babies. You are literally on your own. They have no care, it seems. And that goes to all of the services that they cut, not just Planned Parenthood. They are cutting everything that will help a baby, a toddler, a teenager, an adult. So I totally agree with you about anti-abortion, and definitely not pro-life, because the life, I don't know when life begins, but life activates once the child gets here. And any provision that can be made for that child once they get here seems to be like they don't, so I definitely 1,000% agree with you. Conservatives, they only care about you before you get here. And after you get here, then you figure it out.
It's true. This is true. Well, before Franchon leaves, I want to give her an opportunity to share her perspectives before she has to roll. And then I'm gonna close everything out, because, like I said, I was trying to keep everyone's time in check.
First of all, really good conversation. Donna and Lisa are hitting it home. Like I've been trying to say that, like, you only care till you're out of the womb, and then it's like that just really drives me insane and makes me really upset, because I'm just like, how are you gonna be in my womb but then not in my child's life? Like, that don't make no sense. You want to be in my body, but then you don't want to be in my child. Like, I don't understand. There's no logical sense that makes at all. A couple things. First of all, it sounds like Planned Parenthood should probably hire the same people that used to work for United Way or that currently work for United Way, because clearly we need to make some better decisions. The thing I want to say that's probably going to upset a couple people, and I'm not here to upset anybody, but I just want to be honest, is I think it makes more sense to be relying upon ourselves and the federal government, because clearly they're not for us. They never have been, probably never will be. I'm really tired of hearing about the federal government. I don't care about the federal government in any way, shape, or form at all. Like, it don't make no sense to care about the federal government. It makes more sense to spend time taking care of ourselves and loving ourselves and healing ourselves from the ridiculous amounts of oppression that we experience every day. That to me seems like we're making more progress on that front than we are on trying to get other people to validate and see us and care about anything that impacts us. And then the other thing is, if we're going to stay with the federal government saying, pay me now or pay me later. So if they're saying it's about money, we're talking about $500 million versus spending time with educators. So for example, cancer, like, let's just take it away from abortion for a second. Like, so if someone needs to go to Planned Parenthood to get a free screening, chances are if they get cancer, they're not going to have the ability to get quality care. Which means they're not going to go to a primary care physician. What that means is they're going to end up in the ER every time something goes wrong. So what that means is long term, that costs money. So, I mean, I have a business degree, but it doesn't take a business degree to do some simple math. So either pay them to do the pre-screening and address it early, or you're paying for long-term emergency care for situations that could have been prevented.
That's
like,
right.
Again, the logical sense, none of it is logical sense. It's an emotional, people are coming from a very emotional place, and they're using hype words to get everybody in their emotional feelings. And then they're throwing Christianity in it to get people even more in your feelings. And then nobody's making any logical decisions. And I'm like, okay, can we just please look at some math? Like, can we, and that's one of my frustrations with nonprofits is they don't run like businesses, and they should. Because the work that nonprofits do are more important than General Motors. I think it was Linda said earlier, I'm sorry if I'm saying your name wrong, but she was like, General Motors got this, and big business got this, and big business got this. And I'm like, of course they did. So if nonprofits ran more like businesses in diversified income, I mean, I'm a business owner, so my income comes from multiple different places. I don't have one client. If I have one client and that one client leaves, now what? I can't eat. That doesn't make any sense. I need to diverse my income to make sure that I can provide for myself. So anyway, that's my rant. That's all.
It's okay. I love your rant. I love to hear you speak. Because you're very passionate about what you have to say, and I always agree with everything that you have to say. I'm just going to give Christina, did you have something to say? Lucy, did y'all have anything that you wanted to add before we close our evening out?
I think I do, because I'm just curious. When you're talking about the being non-federally funded, okay, you're talking Planned Parenthood basically is for the poor, and I'm gonna say lower middle class, and maybe from the way that things going, maybe upper middle, because the middle class is disintegrating. So I guess my question is, who are we looking at funding? Who will we look for to get the money to actually fund, to replace the federal funds in which they lost a fund within Title 10?
So I would say fundraising, like I said, I don't do fundraising, and I specifically don't have a nonprofit for that reason. Like, everyone told me your company should be a nonprofit. I'm like, nope, you will not catch me asking anybody for money. But my whole thing is, if Goodwill can do it, if United Way can do it, obviously there's a way for it to be done. So my whole thing is that we need to look at ourselves and at our community and learn from people that do it. I don't know who else does it besides United Way and Goodwill on the level that Planned Parenthood would need to do it, because that is a lot of money, right? Like, it's not like you're trying to have a bake sale, right? Like, it needs to be, it's a significant amount of money. But I think it's like, we need to shift our focus to building our own wealth. And what does that look like, and how do we do that? I'm not saying don't hold federal government accountable. By all means, do that. But the amount of energy we spend in my opinion, on looking to people like the president, regardless of the color of the skin or her skin, hopefully one day. Like, regardless of that, that's one person. There's so many more of us. Like, we have more power. The powerlessness thing is exhausting me. So I don't know who that is. It's my neighborhood. It's your neighborhood. It's whoever's around. Like, because there are people that can do things on grassroots levels that can move mountains. So to me, it doesn't make sense to I think it was 34% is what we said, 34% comes from the government. So make a plan over the next 5 years, we're decreasing that by 10% every year. Regardless of who's in power, regardless of whether Democrat, Republican, like stop depending on all that. Just make a business plan.
Well, they would have to change some of their infrastructure, right? And they are like a niche market, whereas United Way, they have they cover a vast variety of community and social issues. So everything from COVID-19 to homelessness to education. So they run the gamut. So that's why they can pull from all these corporate dollars, these medical dollars, and they're very well ingrained in the United States. So they have the infrastructure already set up and established to do the level of fundraising that they do. And then they divvy out all these funds to these other these community entities. But you're talking about kind of a niche when they talk about sexuality. That's a taboo for some people. HD, you know what I mean? Like the
all the acronyms.
Yeah, all the alphabet, the whole alphabet.
The whole alphabet.
That's a niche. That's a niche that some people don't want to touch. So there's stigma around birth control and those things. So they can't get into as many pockets as say the United Way can.
And I just add to that, education is the key. And part of the problem is, and the other thing I want to say is all politics are local. So it's really not about the president eventually it does get there, but it starts at the state level. And fundraising is fundraising. I mean, really, when you go to the government, the funds are being raised, whether it's through taxes or whatever, in order to accomplish whatever the goal is. One is just more direct and the other is indirect. So when you say education is the key, and I think Georgia is the example, and Stacey Abrams wrote the playbook that it's grassroots, and if you educate the people and you let them know, and then the people begin to make choices to put locally and federally people in office who are of like mind, and then we can put laws and bills into place that will support not only Planned Parenthood, but the whole process that will help people of color. I think that's the main thing that's where the change comes. So the problem is there's a disconnect, and because we people of color are most affected by this, if they remove it, we are the ones that need to be standing in line voting for the mayor and the city council and those individuals and the dog catcher and the sheriff and all of those individuals who will work with us so that we can then make those changes on a federal level. The fundraising is actually it's fundraising. It's just who's raising the funds, and we've got to begin to move people out of office who don't think like we think, and that starts at the ballot, locally and federally.
That's right. That's exactly right.
Okay, I'm for real. Lisa, where are you from? Where do you live currently?
Philadelphia, New Jersey.
Oh my gosh. I'm just happy to know you're alive in the world. Thank you. I mean that. You don't understand. You don't understand. Wilmington is rough. Like, Wilmington is, I've been crying for 2 days. And I've been through some stuff. I've had guns in my house. I've watched my mom get raped. I've been through some stuff. And Wilmington, undoubtedly, if anything's going to break me, it's going to be Wilmington.
Yeah.
This place is horrible.
We are going through some mess down here. And I looked it up. It's 18%. And for you, some of you all who do not know, this past weekend, we had a mass shooting. 8 people were shot. 3 people under the age of 21. The youngest was 16, was killed. Earlier that day, I think it was 4 o'clock that afternoon, 2 blocks up from where they were shot, 2 other people under the age of 25 had been shot. 2 months prior to that, we had another shooting. Am I right, Franchon? Another.
Yeah, I mean, yeah, there's a lot of that, but it's what you just said, Lisa. Like, there are Black and brown people here that will not work together, will not vote, will not, and I'm not saying that's not a thing everywhere, but the problem is there's so few of us that my mentality is like, yo, can we get together on one thing? Like, I don't care what it is. Pick one. I don't care what it is. I'm here for it. Like, I will show up. Like, Fawn will tell you, like, I come through. Like, if you come to me, like, Franchon, I need you to come through, I will come through. I'll do whatever it is you need me to do. You have to tell me, like, yo, I need you to be here this time. But my point is, there's so few of us, and it's like, we're still acting like it's slavery. I'm like, yo, we're free. Like, we are free. You didn't know this? You were born free, homie. Like, can we please stop? You know what I mean? So it's like, when you talk about things like education, it's like we can't get it for some reason here. Like, we're so busy, not even only killing each other, but just like fighting each other, like just the catty stuff, you know, like it's not even the dramatic gun violence that bothers me. It's I can't even support my sister without there being a problem. I'm like, yo, can we please, like, can you hate me tomorrow? But today, can we be free today? And tomorrow you can go back to disliking me. You know, it's just like that kind of stuff. And I've never seen anything like it. I lived in New York, Florida, Boston, Ohio, West Virginia. I've been to Africa, London, and Mexico. By far, Wilmington is the place that I'm like, yo, I don't know if I'm gonna make it. Like, I don't know if I'm gonna be okay tomorrow. And that's crazy to me. Like, it's such a crazy concept to me. But then when you find out about the history and all the things going on and stuff like that, it makes sense on a cognitive level. But on an emotional level, it's still hard to be here.
And at some point, you have to break the cycle. At some point, it has to stop. And the Black people, my family is from down there. My grandmother, Wilmington. So my cousin lives down there now. So I'm a little bit familiar with Wilmington, and it is it's a microcosm. Yes, generational curses. It's a microcosm of what is happening in a lot of our cities around the country, where our people are so disenfranchised that it seems like they can't come around. But like I said, if they could do it in Georgia, and Georgia's up against another one of its biggest fights in these next couple of months, going, and all of us trying to get into 22. It takes education, and it's going to take town hall meetings, and it's going to take kitchen clashes at the table to help people to understand that your vote counts, and it is important that if the change that you want, even if all you want is a welfare check, you've got to vote,
right,
in order to secure that check for yourself. So it's somebody's got to, I don't know who it is, I don't know what group that is, in that area that can just come to, like, you need your own Stacey Abrams to come down there and say, look now, you guys, we cannot let these white people come in here and turn Wilmington. I mean, they already have done it, but we can flip this thing. Even though we're the 18%, we can flip this thing. And you just need, it's got to be grassroots.
Yeah, I agree completely. Anyway, so when I say I'm so thankful to know you're alive, I mean that. I just wanted to explain why I said it.
Well, I'm cutting the recording off. So first of all, before I cut it off, I just want to, first of all, thank all of you all for giving me your time because time is precious. I know that all of you all could be doing whatever it is that you would like to be doing in this particular time. So I'll thank you for giving me an hour and a half of your time to discuss this. Um, and I am available. Y'all know, you need me, I'm there. I Me and Lisa been fighting. She would argue with that lately, but
So true.
but I am there. I am there if you need me. But and so what I would like to do is speaking. I know that we're speaking in terms of Planned Parenthood, but I would also like to encourage in each of your areas, maybe we could start doing this, more often and invite two people to come and we find a topic that is important and for all of us in each of our areas, that's important to us, but it's also relative to your local community. And the more we do something like this, what I have found as Black women, we are powerful. We can make a change like nobody's business. You hear what I'm saying? That we can turn things around quickly. And so with that understanding, if we look at our schedules, I know we all, like I said, we all have different things, but I don't have a problem with organizing and finding a topic, putting it together in 2 months. We talk about that, bring two people, and let's really try to push the vote. My cousin Denise, and you all please pray for my cousin Lisa. That's her sister. She's in the hospital with COVID pneumonia. Lisa is the chair of the Democratic. Denise, what is it? Is
Advisor for the Pennsylvania Democratic Party, and she's the chair of the Black Caucus in
Yeah,
Pennsylvania.
she's the chair of the Black Caucus for the Pennsylvania in Pennsylvania. And so my family is very political. We strongly believe in, we talk that talk and we walk that walk. We don't just talk about it, we're about it. We be about what we're talking about. And so I have no problem with creating forums and spaces so we can begin advocacy and doing something to push the needle for change, especially here, you and I right here, Franchon, whatever we have to do, because I'm working for my city. I want to see my city come back, and I want to see change in my city. I love Wilmington, as all of you all want to see change in your respective areas. And it's us. Sometimes we don't know that God is calling us, but we just have to be staying in the place. God doesn't qualify the call. What is the saying? God doesn't call the qualified, he qualifies the call. So there's a reason. So I appreciate you all for this moment in time. I love you all. And I'm just a phone call away if you need me.